Good afternoon, Dr. Dieter. I'm Dr. Utkarshaa Jaiswal from the Dental Practice magazine, and it's a pleasure meeting you here at the Ivoclar event, and we would like to ask you a few questions. Could you first briefly introduce yourself for the audience?
Okay, so I'm Dr. Michael Dieter. I'm actually a Germany graduated, I'm a dentist graduated in Germany, but I'm currently practicing dentistry in Switzerland. And I'm also part of the Ivoclar Training Academy in headquarters in Schaan, Liechtenstein, where I'm responsible for direct restoratives and prevention.
Amazing, sir. Could you please tell us briefly about the new composite that has been launched, the Tetric N-Ceram 2, and how is it different from the other composites in the market, as well as how is it different from the other composites that Ivoclar has previously launched?
Okay, so as you know, the Tetric N2 line of composites, they are different in a way that they are actually a full system where you can do layering technique. So that's with the Tetric N-Ceram line. These are for layering techniques with multiple shades and translucencies. But then you also have a system called Tetric N2 Power Flow and Power Fill, which are for bulk fill technique. So now you have a full system where you can optimize your workflow for the posteriors, being more efficient, streamline your workflow, but also have a system for your, when you need multiple shades, for your anteriors, for example, for layering technique. And especially the latter one, the system, this one here, called Tetric N Power Fill 2 and Flow. This one is jam-packed with technology, so that is very different from other materials in the market for bulk fill, because most of the bulk fill materials are designed to be too translucent. Because, you know, in order to gain curing depth, manufacturers tend to make them too translucent so that the light can travel easily through that. The downside of this is the material will look too grayish. It's a grayish looking restoration that patients don't like. Now this Power Fill and Power Flow too is not too translucent, but with a, let's say, a catalyst system called Ivoclar, we can achieve this very good curing depth without making the material too translucent. So that's pretty much a difference. There are many differences, but I cannot probably focus on all of them because otherwise the interview would be 2 hours.
Interesting. So there's one problem that most of the clinicians face, that is most of the composites stick to the application instruments. So what is the solution to that?
So the solution to that first is to pick a material that is not sticky. So the Tetric N2 line of products, they have a sophisticated filler system. And the distribution of fillers can make a difference. Let's say if you put too many nanofillers and very small particulate fillers, you need more monomers. That makes it more sticky. That's why we have a balanced nano-hybrid filler technology comprising of larger fillers for the strength, but also smaller fillers with this special spherical mixed oxide. And that mix makes it less sticky. In addition, this material does not slump, so you can pack it.
Okay.
So even if it doesn't stick, but you pack it on one side until you cure it and it slumps again, then of course there is no benefit for you. The other thing is, Ivoclar has a special composite shaping instrument. This one is called Optrosculpt, and especially the pad. You can see this is a foam pad that doesn't stick. Yeah. So the material does not stick. For example, if I use a little bit of composite here and I place this, it doesn't stick. You can see it does not attach to it.
Absolutely.
And that's really, really great when you do all your anterior restorations, class 3, 4, and direct veneers. It's a fantastic. In today's course, I asked the participants who use that. So I would say about 50% used it. And I asked them, do you like it or do anything to criticize? And they said, we love it. And that's my experience also. Those dentists who tried it, they want to keep that.
Actually, I'm a dentist myself and I have tried it, and we always use Optrosculpt pads for our composite materials.
It's not a...
It's one thing that we cannot do without.
Okay, that's good.
So definitely. So the right kind of material and the right kind of instrument is the key for the composite to
That's
not
right.
stick
That
and a good
combination,
restoration.
that
Yeah.
combination is very good. But let's say even if you use a more sticky material, some other material, you can still kind of manage it with this instrument. But the best is if you have a non-sticky material. And I mean, there's a certain stickiness. I mean, a little bit. Every material has. That's normal because it's a viscous material. But then with this one, it's easy to handle.
Absolutely. So another challenge that we face is that shade matching is a challenge, especially for the anterior teeth. So what are your tips and tricks on that part?
Okay, so for the shade matching, I think the key is that we take the shade very quickly. Because when we dispose the tooth for the shade matching, we already start the dehydration process. So we know that we need to take the shade within 2 minutes, because after 2 minutes the value, the brightness is higher, much higher than the original tooth, and the opacity also is increasing. And this is why we need to be quick first. But then when you take the standard shade guides, which is arranged to the A, B, C and D shades, they have all different brightness within their own shade range. And that makes it very confusing and time consuming to take the shade. That's why I'm suggesting to rearrange that, take all the shade tabs out and rearrange it according to the value, which means that the brightest shade is not an A1 but a B1, for example. And then go down the line, and then you have a very quick shade match, and then you are faster. That's the idea.
I think perfect. That's a very good tip actually.
Yeah.
Thank you. So and then okay, so there are a lot of curing lights available in the market. So could you please elaborate a bit on the parameters to look at while choosing the right curing light?
Okay, so first of all, I think curing light is a device where we should invest in high quality, because these curing lights stay with us for many, 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 many years. And we know from studies and also from clinical experience that a lot of failures of direct composites are related to the under-curing of the composite material. So we need to have the knowledge and we need to have a good device. So definitely you should not buy one of these cheap Chinese lights through Alibaba or whatever platform. Yeah. So this is really, really not a good thing, because this is a medical device that is integral part of our quality control. Okay. Now, the thing is, we need to have the first one is a broad emission spectrum, so that we can cure any curing light in the market. So usually this is not sufficient to pick a curing light that only emits blue light, but it's better to have a more wide spectrum of curing light. For example, the Polywave LED technology from Ivoclar offers not only blue light but also a purple LED. And now together they make it a wide spectrum, so that we can cure any composite in the market and we don't have incompatibility with some of the materials. I'm mentioning here the brighter shades that more and more patients are asking us to use, like a B1 shade or a bleaching shade. So those materials have different kind of a light curing catalyst, and in order to also activate them, we need to have a broad spectrum curing light, such as the Blueface NG4, for example.
Okay, wonderful. So we heard about Viva Pen and that it won the Best Design Award. So what are the unique features of this product?
So the unique feature of this pen, and I was actually proudly part for the development of the pen since decades. Yeah. So the first pen, I remember this, the prototype, looked very different, and the functionality was very different from it is today. You can see, I can imagine that this can win a design award, but no dentist would buy this just because of the design. So, of course, we're not talking about the content inside, that must be superior as well. But the thing is, for the ergonomics, yeah, you can actually, by each click, you have a little bit material coming out of this. So you have total control on the dosing of the material.
Okay.
Now, if we compare this pen delivery for the economical usage with any bottle system, this one is much more economical, because we almost have no waste. Yeah. So you actually have, if I just show you this one here, we also have this brush cannula, which we can place here, And you can see we click 2 times or 3 times, and you can see just that little amount of material here.
Absolutely.
So this one would be good enough for a small cavity. So I apply this on the small cavity, and if I see I need to have a little bit more, I give just one more click. So I have extremely precise dosing and no wastage.
No wastage, absolutely.
And I can control everything here. You can see there's a level indicator, like your petrol in your car. You can exactly see when this white line here is going down here, it means the bottle is almost empty.
And then we refill the bottle again.
At the current stage, we cannot refill it.
Okay.
But we're working on that. We can. You know how many fillings we can do with one pen?
No, please tell me.
It's about 190.
Oh wow!
So,
wonderful.
so you can see how effective and efficient this material is. So if you calculate the cost per usage, it's almost unbeatable and better than any other bottle system. And also the good thing is, just for the application, I can rotate this 270 degrees, so I always have the correct working angle. And I can still bend the cannula a little bit. So this is, I think it's really a dream to work with. If you have tried it once, you want to go back to it.
Absolutely. Well, no wonder it won the award. It deserves it. Okay, so lastly, what is your take on the level of dentistry in India?
So, I mean, this is one of the really surprising things. I mean, I've been traveling for the past 24 years in India. Of course, there was a break during COVID-19, but luckily I can come back. And I have met many colleagues through the years and sharing cases. And the cases I see what they're doing now is really unbelievable. So I think the level of dentistry in India is really progressing very quickly. And that makes me proud, because this is really a good way to see the Indian dental community getting so professional now these days. So this is good.
That makes us proud as well. Thank you so much, sir. Thank you so much for your time. This was amazing.
Yes, thank you
very much. It was a
much.
pleasure meeting you, sir.
Thank you.
Thank you.
Thank you. Thank you, Doctor.